Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Articles.
Oh yeah, it's done. Everybody know about the world's first eye transplant. Everybody knows that we've been doing corneal transplants for quite a while to get people to retain their sight after they've had damage to the cornea, but we've never really tried a full eye transplant. Now, it's interesting that this eye transplant has been done, but it still hasn't resulted in the patient seeing. But anyway, it's important to recognize that this is the world's first eye transplant, even if the patient is not seeing yet. The hope is that he will, but anyway, it has been done. So the rest will follow. Maybe within some years or so, we'll be able to actually have an eyeball transplant that actually restores sight. But the fact that the first has been done is something to share the information about the possibilities that can occur. You know, we recently talked about the xenotransplant and the fact that the first two heart transplants have both died, but that this may be the opening step of a trip that becomes a long voyage. So we shall see. It's nice to know that we're not giving up. We're trying to keep moving forward. And of course, the eye transplant is the beginning of getting to the point where we can actually transplant the brain, which certainly has not been accomplished either. But anyway, it's good to see that people are still working on trying to make the impossible possible. Mm-hmm. Any comments on this first of its kind?
John.
I have a question. So this
I muted you by accident, John.
Okay, sorry. This type of surgery is now commonplace where you can
No, this is the first of its time. It's never been done before.
I'm talking about the nerve. Can you reattach nerves? Is that?
Yeah, we've been doing that. Yes. Okay. Yeah, we've been doing that for some time. Yes.
Yeah. So that was my question.
The nerve. We've been putting together nerves after trauma and other things like that, and the nerves have grown together. But we just haven't been able to do things like the eye, which actually requires the brain, the working together, the brain as well as the nerves. And so far that's not been done.
Yeah. My comment on that would be that a lot of species see different light spectrums than humans do. Like predatory mammals usually see a lot stronger infrared, insects see a lot more ultraviolet. And, I'm just wondering how this whole process might expand our the way we see in light spectrum.
Well, everything's possible. So
yeah, we'll find out.
Opening the door. Yeah, we'll see. At least you'll be around to see. Okay. Next slide, please. Now this is complex because you look at the face of it and say, how can a breast implant help a lung transplant? And what happened is that this young man had a bad lung infection, which most lung transplant patients do because they have cystic fibrosis and COPD and other things like that. And but in this particular man's case, his infection was so bad that they could not do a transplant. So they took out his lungs and gave him oxygen on the ECMO. That's a machine that allows the oxygen to go into the blood without the lungs. But the thing is that when you have no lungs, you don't have support for the heart. And so what they did, they put the implanted breasts to keep the heart in place. And they put that in there, and then they kept him on ECMO, which is the extracorporeal membrane oxygenator, and gave him the oxygen. And then after they got the infection all squared away, they then did the double lung transplant, and that was successful. So the strategy was to clear all the infection in the chest cavity, put in these breast implants to keep the heart stabilized. And then they proceeded to find a lung for him, and that was successful. So it's another episode in which we've really strained what is impossible to making it possible, because this man otherwise would have died. And if we'd taken out his lungs and the heart was unstable, then that he would have died as well. So this is novel thinking where they put breast implants to keep the heart stabilized while they freed him from the infection. And then after the infection was cleared up, they then were able to do a successful lung transplant. I just wanted to show you how innovative and creative things we're doing. It's interesting how that follows right after the eyeball transplant, which was unsuccessful. But this was successful, and this shows you that you can conceive it, it can be done.
Dr. Callender, I have a question. Is the breast implant made out of silicone?
Usually, yeah, that's what it's often made of, which is inert, and so it it's occupies space, but is not capable of resulting in being infected or anything like that. So, but yeah, silicone usually.
So the purpose of the implant was to just reserve the space where the lungs were?
Well, no, to do two things. One is to fill the space, the other is to stabilize the heart, because the heart is right in between two lungs. And so if you don't have that there, it becomes unstable, and then you have heart failure. So that was the concept. That's not been done before either. So it's interesting that there's so many different ways to skin a cat, as they used to say in the old days.
I thought it was also important to emphasize the fact that he got that infection from smoking and vaping. I think we need to really, press that point, because a lot of kids are vaping and doing a lot of damage.
Yeah, thank you. Good point. The other thing is that the emphasis on still the fact that infection and transplant don't go together. So you got to rid the body of the infection before you do the transplant. Okay. Any other comments? If not, this is an interesting article that, and I want to include this because we've been talking about CRISPR therapy, genetic reengineering, and going in gene editing for some time, a couple of years now. And I guess one of the things that has happened over time is that this new therapy, which they won the Nobel Prize for, I think 2 years ago, is now penetrating almost every area. One of the things that is in this article is that this can theoretically, you put this gene editing mechanism in place, and the virus of AIDS could be killed, and that could be a cure for it. It has already been effectively used in the treatment of sickle cell disease.
What?
As you know, that's a disease that affects us more than most other ethnic groups. And 31 out of 32 sickle cell patients that have been treated with this technique have resulted in the elimination of their sickle cell crises. So that this CRISPR-Cas9 technology may benefit many, many people. We also recognize the willy-nilly utilization of gene editing is not so good, but using it for the right cause is good. Does anybody understand what CRISPR-Cas9 is? That's the situation in which this technology edits the genes. So those genes that are not good for you and that cause disease, you use this technology to eliminate those genes. And this is a situation where this could apply to HIV. It is already applied to sickle cell disease, where sickle cell gene has been eliminated.
Excuse me, Dr. Callender. When you say you removed the crisis, that means you still have the disease, but you don't have the problem with it?
No, when you remove the gene, you actually remove the disease for the most part. But you do, since, for example, the person has had the sickle cell gene, has had crises all of their lives.
Right.
And so when you modify and eliminate that gene, theoretically, your hemoglobin S is then eliminated, which then means you have hemoglobin A, and that then can take over and eliminate the disease in theory. Now, recognize this, we've only done 32 cases with this, and so it's early on, but the early indication is that it has virtually made them no longer sickle cell patients. Well, time will tell. If you only done 32 cases, you don't really know all the ramifications.
Right.
But we do know that it certainly has worked so far with sickle cell disease, and the hope is that it will do the same thing for HIV. Now that's all theory, because that has not been done with HIV yet successfully. But there's the prospect that since this has been done for sickle cell disease, it is likely to be able to be done for HIV as well.
I will have one more question, Dr. Callender. I have a friend that passed away. She and her two sisters and her mother all had that gene for breast cancer, and they've
Yeah.
all passed away because of that. And I was wondering if that's something that they would be able to utilize that for.
Yes, I think down the road, yes, makes
Yeah.
sense. Yeah, that's another thing that they would try to do for those cancers that are genetically associated. Yeah.
Yeah.
Look at that, $2.125 million per treatment.
Oh well.
Well,
Yeah, Doc, I always wonder what CRISPR stands for.
yeah, there it is right there. You have it. Yeah. Cluster regular interspaced short palindromic repeats. We've been talking about it now for about 2 years, and they won the Nobel Prize for it 2 years ago. And the gene editing process is something that allowed for the xenotransplant without the rejection that usually occurs immediately after transplant. So far, it's done away with it for at least 30 days. Now, question is, how can we make that work? longer. Any comments, question as about anybody have any problems with the ethics of this gene editing technology?
I have a serious problem with the ethics. It just it reminds me of that movie, the Boys in Brazil, where they got some DNA from Hitler and made a whole bunch of new Hitlers
Uh-huh.
out of it. But and also Gattaca, where they edited somebody's DNA to protect them or allow them to be hired as astronauts. That it's got to be an ethical component with using this, and it seems that that's a whole area of science now with ethics that I guess it's been there for a while. I think they had one of the institutes at the NIH deals with that, with ethics.
Actually, NASM, the National Association of Scientists, Engineering and Medicine, has looked at that, and they have criteria established for which you would use gene editing. And what they recommended is that it only be used in cases where people would die without it. And so that's been the recommendation by the Ethics Advisory Committee relative to the use of gene editing therapy. But it is an ethical dilemma that will be with us for some time, because people, if they're not appropriately monitored, would edit genes for many unwise reasons. Maybe the color of the eyes, the IQ, and so forth and so on. But the intent is this to be used to save lives and prevent death. And so those genetic conditions that will cause you to die, this is where the use of genetic engineering and genetic editing can take place. But you're right, this is an arena that is not whether you can do it, it's whether you should do it. And so that's the issue.
Dr. Callender, we have a guest here. I'm trying to get her name. Can you tell us your name? Is your audio working?
Can you hear me?
I can hear you.
Oh, it's Roma Smith. I've joined a couple of times before, but it's been a while.
Oh, okay.
Welcome. Good to have you.
Thank you. Thank you. I'll share with
Could you put your name in the chat so we can?
Okay, I will. I'll do that.
Thank you.
I'll find my way back there.
Okay.
Welcome. Glad to have you.
My question to you, Dr. Callender, and also to John, when you talk about ethics, I think you're talking about, the United States of America, because we know that around the world, different countries have different ethics. And so, whereas, over here in the United States, we may do something or we might not do something because of ethical values, other countries will jump on top of it and turn it into cash money.
Right. Yeah, that's correct. Yeah. So, and you're right. What we're talking about is the ethics of the scientific world. Okay, and this is something that is beyond just the United States. But your point is well taken. Just because we have rules that we think apply to everyone, some countries just totally ignore it and move forward. So it's a good point. Yes.
Yeah, Dr. Callender, I have another, part of that discussion about ethics. and the boys in Brazil, that's like cloning, right? Or you can, make copies of animals, and you could do the same thing with any species. But so the other question that I had is all of the chances of making mistakes. Okay. Um, yeah, CRISPR is a awesome tool, but suppose if you mess up, suppose if you cut the wrong molecule in the wrong, or the right molecule in the wrong place. It just seems to be so much variability, so much possibility of error in that. So, you have, humans to be guinea pigs, sort of, I guess. I guess it would try it out on lower species, rats and maybe even monkeys, even though
They've already done that on the lower species. They're now doing it on us.
but I'm just thinking, you understand my point. It's so delicate to cut a molecule. Okay, we're talking about the molecular level. It's not like you come in with a pair of physical scissors. It's and Dr. Atto knows that, with the immunology focus, you can do that on a very specific level. Suppose if you mess up.
Well, accidents happen with everything. And so, yes, and what is even more sinister than that is that we don't really know what happens after we interfere with the gene of one aspect of life. How does that impact the rest of the person's life? See, we don't know the answer to that. So it's really an experimental technology that has benefits, which is why you only want to use it for situations where the patient would either die or their health be compromised, so much so that they're not likely to live. So that's why they're starting off with conditions, for example, like genes that wouldn't allow you to live in the first place. And so you then have somebody who would have died who lives, and then as you proceed, as you point out, you work on HIV, which is a disease that is thought to be almost incurable, although people survive with it, as you can see here, that 90% of people who have HIV are surviving. And that's why the comment that she made relative to cancer is a good opportunity to address the cancer gene. But what you're bringing up is, what is the downstream effect when you address that gene? How else are you affecting the entire gene pool? And the answer is, we do not know. One of the things that we talk about in kidney disease is the fact that sleeping sickness protective gene is the same gene that causes a kidney disease. We know that now. We didn't know it before. And so as we make these changes in the genes, what is the downstream effect of that? And we don't really know yet, and time will tell. But it's appropriate for all of these changes that the community be involved, because it's not whether or not you can do it, it's whether or not you should do it. And if you do it, is it something that you want to go? And so this is, and this article is CRISPR safe, and that's and this is talking about sickle cell disease, which has the potential of being DNA altered by Cas9, and the early results have been spectacular. And so that now, but we still do not really know the downstream effects of this, what happens to that person 5 years from now? We know that this may stop the crises now, but what is the downstream effect? Is there, for example, with the sleeping sickness gene, we now know that while it protects us from sleeping sickness, it predisposes us to kidney disease. So, is there something like that with these gene editing mechanisms? And so it's interesting that we can keep up with this technology because the community has to play a part in this, because otherwise we will go wild with it. And John Buchanan's concerns become reality.
Dr. Callender, my question is, with the use of robots and also artificial intelligence and the combination of the two, is that cutting down on medical errors?
I don't know. We haven't been doing that long enough to say. We still have 100,000 medical errors that result in the death of patients. So there's been nothing so far that has eliminated that human error.
Well, I'm thinking that sometimes they use robots in order to make operations more precise.
Yeah, following up. Yeah, that's true. So what are you thinking relative to how this would help with this?
Well, John was talking about making mistakes when you're editing genes. And so that's why my question was, how could artificial intelligence and robotics help to solve those mistakes?
You have no idea, because we don't know of any mistakes that have been made yet, but that doesn't mean they haven't been made. We just don't know them. So I don't know. We don't know enough about the technology to answer that question about how would the robot and AI interact with CRISPR-Cas9 and the gene editing aspects of it. So that remains to be seen.
Dr. Callender, this it's on the screen now, shows an error that was made. 2 participants developed blood cancer as a result of the CRISPR treatment. So yeah, this is a possibility, downstream.
Time will tell.
Gene.
Yeah, time will tell. Time will tell. Just like with the mRNA, with the saved many lives because of the pandemic. And what is the 10-year downstream effect of that? We don't know, but time will tell. And that's the aspect of it that we don't know yet. Time will tell. But I think you raised some very important concerns. Ethics is about right from wrong, and what is right for the day is not necessarily right for the year. And so life is not a sprint, it's a marathon. And so the ramifications of what we do today may not be known for a while. So preliminary evidence is that this is a great thing. Time will tell. Any other comments? Very fascinating new technological advantages. And the question is, Are they safe in the long term? Short term, seems like the answer is yes. Long term, we don't know. But we do know that you have your child is having all these crises, and it's so painful and so problematic that most people, for their children, they would want them to be free of the crises. The question is, what is going to happen 10 years from now? And we don't know. Any other comments? Thoughts about this new technology that's revolutionizing treatments? Very spectacular, though. Well, let's go to the next one. Interminably, and we seem like interminably we're talking about ultra processed foods and how they affect your health. And we've been talking about that for years as well. But I think there's much evidence that many of the foods that we like and enjoy are actually killing us. It's interesting to see how more kids and teenagers are eating ultra processed foods than adults. And just as Darryl has been saying for many sessions, these ways in which they try to make food more appetizing and more delightful to the taste, the worse it is for our health. And so they talk about chicken nuggets, chips, hot dogs as being good examples of very popular foods that are ultra processed. And therefore they contain toxins or poisons that are not good for us. And there's so many things that are processed as it is that it's food for thought. And this is why fruits, vegetables, and things that are not so processed are healthier than these other things. But it is true that these so-called ultra-processed foods are tampered with so they can taste better and make you want to become addicted to them. And so the question is, how is this going to be done in such a way as that ultra-processed foods, are they going to be limited, or are they just going to be bad for your health? And because they taste good, you just eat them. There's a little question that they are bad for your health. The question is obesity, diabetes, cancer, cardiovascular disease, and other things are associated with them. And so the question is, how do we know? And then, of course, to say that you got 20 health volunteers, that's a small number, but still, it's a start. Probably very few out there in the audience who not eaten some ultra processed foods and enjoyed some ultra processed foods. The question is that a rare event or is that a common event? If it's a rare event, may not be so bad, but if it's a common event, then your health is jeopardized. Any comments about this article, which is a very good one, that forces us to think about things that we have been talking about for quite a while?
Yeah, I'm very upset about this article. As it said,
Why?
said
Why?
cookies and sausage. You know, if it doesn't grow on a plant where you can just pluck it and eat it, then it's processed, right?
Yes.
That includes. I think if I look at it, most of what I eat, right, even though I'm eating a lot more fruit these days, but even milk, cheese, cookies, I don't know, sodas, all of that stuff is processed, and a lot of it is ultra processed. I don't know. I don't know. It's very upsetting to me.
Well,
I
it's
feel
appropriate
guilty.
because yeah, it is.
I saw a video the other day, and in the video, there was this lady talking about the father of medicine, Hippocrates, I guess, and she said diabetes is a lifestyle disease. It's not even mentioned in the article of the father of medicine so many years ago. And she said the highest food on the glycemic index is wheat. And it was used years ago to help feed the people. It was modified to help feed people in Africa, India, and even higher than pasta. So that's just a note. I just saw that the other day. It was interesting.
Yeah, yeah. Any other comments about this fascinating article that says we're eating ourselves to death?
One thing that comes to mind for me, Dr. Callender, is that it's very, very hard to shop and find food that's not ultra processed.
Well, Darryl has been saying that for quite some time now. Yeah.
Or restaurant, for that matter.
Huh?
You know, you can't find the grocery stores, nor the restaurants, nor anywhere where you can go where the food is not ultra processed, except maybe a vegan place.
I'm vegan, vegetarian. I cook fresh. And even if I prepare beans, I prepare dry beans. I try to do as little few cans as possible.
Yeah, it's not that hard. You know, there's a certain thing they call sacred cows. Those are things that you love so much that it defies all common sense to keep them. Ultra processed foods only started happening in the 70s, along with frozen dinners. Before that, we can all remember how our parents and our grandparents cooked before the 70s. And the key is to cook. You know, it's like all of these products that you get that are pre-cooked in the frozen in the cooler section. You're not going to the grocery and getting whole foods to cook. That's the way our parents and grandparents did it. It's not that hard. It's just that all of these conveniences, we're looking at them as sacred cows and we're scared to death to kill them, like something's going to happen to us because of our lazy behinds.
Well, that's cutting to the chase.
Dr. Callender, I had my general physician, primary care. He told me, you know, one way to reduce or anything. He said, if you like it, don't eat it. It's just your favorite foods, just don't eat them. If you know you find yourself gorging out on it, he said, don't eat that stuff. It's no good for you. And it was true. Everything I liked was not good for me. So
well, you know, there are those who argue that even though, as Darryl would admit, even those things that you think are healthy, you can make them tasty. Look at Darryl; he's been eating those things, and you've gone to his house and you enjoyed eating it. So that there's a way of preparing it that can make it taste good.
Yeah.
I did enjoy it, but it seemed like it was a lot of it didn't seem like he was doing a lot But just for me to get the ingredients that he was making the stuff out of, that would became a headache for me. But I did enjoy eating it. It was wonderful because somebody else was cooking it.
Yeah.
I think that's
Food can,
part of our problem. We're
yeah.
used to, I'm now living alone. And I've always had my kids running in and out and, always a lot of traffic. And eating fresh is good, but Darryl, I think I've become lazy. You cook all this stuff, then you have to do dishes. So the quick way is to do something quick. And it's right about eating foods that we really like, don't eat them. I agree with that. Sometimes around here at night, I want something really good. But if I go to the grocery store, I'm not going to buy it. Because if it's in the house, you're going to eat it. And that's when you do the weight gain and all of that. So don't make it accessible to you. So then what? Don't buy foods that I don't want to eat. Don't cook because I don't want to do the dishes. I think I've become lazy around the house. So
Life is way too short to not enjoy your food. I mean,
Yeah.
that's about a quarter of life. I think food has to
Yeah.
taste good.
Yeah.
The food I eat tastes good. I'm not going to deny myself good tasting food.
Right.
My parents and my grandparents had good tasting foods. It just wasn't ultra processed. So you may
Right.
have to learn to cook in a different way.
Uh-huh. And that's how my mother was a great cook. And when you look at the today's cabinet of condiments and all these different ingredients you cook with, all she really had was salt and pepper. Now she did her other little magical thing, but if you look around for the fancy garnishes to make it more appetizing, years ago, our parents and grandparents, they just had that knack to cook great food, always tender, always tasty. And they didn't do all these extras that we do today and add the new additives that sometimes I think we just buy extra things because we see the commercials on TV. So that changes our mind a lot too.
Well, you can learn to be a spice master. There's a lot of great spices that we've talked about in the group session. My spice cabinet has got well over 50 different spices, and I know how to use them. I'm not ashamed to
Okay.
use them.
Okay.
And, they can really light up some food, but it's never too late to learn.
Yeah.
Yeah, so I think the key, as he mentioned, is that healthy food can be tasty too. So that's the take-home story: is to get healthy stuff and fix it so that you can enjoy eating it. That's easier said than done, though, and that's the problem.
Well, I invite all of you to come visit me, and I'll put you through a 1 or 2 week boot camp. I'll cook. I'll show you how to cook. You can enjoy your food, and you'll go back to your home a changed person.
I have a question for you, Darryl. So, some of the food in the frozen section, that okay as well? Such as the frozen fruit, frozen vegetables, things like that. Is that okay?
Read your labels. Most of it in the frozen in the cooler section is not okay, particularly if it's if it like the article said, if it's not something that you can do in your kitchen, if it's frozen vegetables and that's all that's in there, perfect, no problem. Uh, but if you got something that's frozen and prepared, like that, just eggs is popular. So egg substitute, all kind of chemicals in that. If it's if it's something that you can take it out of the freezer, thaw it, heat it, and eat it, it's probably going to be a huge problem. And the reason why is that, okay, fats are a great thing. Fats make food taste good, but when you freeze them, it separates. And when you thaw them, it mushes. And so to solve the problem, they put in emulsifiers. And emulsifiers make it highly processed food and it destroys your gut health. So emulsifiers are a huge problem with most of the stuff in the frozen and the cooler section.
Okay, so I was specifically talking about frozen fruit and frozen vegetables, just just without any. It would seem that they would not be processed except to be frozen.
Yeah, there's some fruits that if you freeze them and thaw them, they'll taste okay. Others will mush out.
Okay.
Just got to read the labels. You start seeing an alphabet soup of chemicals in the labels. It's highly processed. Don't do it.
Got it.
Yeah, if it says green beans and water, there's no chemicals in green beans and water except for H2O. You're good to go.
Okay. Next slide, please. Oh, this is this is interesting because there's some products that they found lead and heavy metal in chicken nuggets and some Tyson products. And of course, we know lead is no good for you. It messes up the brain and many other organs. And so there's been a recall of many of the Tyson products as a consequence. I don't know about these cooked fun nuggets and shaped chicken patties, but these are examples of because of the lead content and metal content, they were recalled. Most of those in either is, but Virginia is one area that's close to us. Fortunately, most of these products we're not aware of. I don't know if you know about any of these things. But we do know that lead causes many problems for adults and children. Yes, you had a comment? Any comments? If not, it's just since we have children and grandchildren, to be aware that there's a recall for some of these products.
Back to something we said earlier. I visited my doctor yesterday. He was a gastroenterologist, and he was telling me, John, that fresh frozen food is okay for me. Fresh frozen food, FFF.
Got it.
Okay, let's go to the next one, please. This is this is an interesting article because FDA is saying that all those things that people have been taking for their colds don't really work. And you see the list here: Benadryl, Sudafed, Tylenol, chicken soup is the perfect remedy for cold and flu. Remember, we talked about that last week. But what they're suggesting is that these products make money, but they don't really help you with your cold. And so they are recommending that they be taken off the market. They don't accomplish. So, John, for your cold, I hope you're not taking any of those things.
I did take some cough syrup last night, though. It didn't work.
Yeah.
That's because it didn't have that alcohol in it.
Well, most of the cough medicines do have alcohol in it.
And some of it can raise your blood pressure.
Mhm.
Gonna be interesting to see the feedback and see if in the drugstore they actually are removed.
Dr. Callender,
Yes,
I'm hearing a lot about probiotics as a supplement. What's a probiotic?
probiotic is a combination of bacteria that allegedly called good bacteria that theoretically allow for your digestive system to work better, theoretically. There are many studies that suggest they may or may not be beneficial, but it is the belief that the makeup of the GI tract consists of a lot of bacteria that help digestion of food and bacteria that make digestion of food difficult. And some of these, like C. difficile and others, really make you sick. And it is the thought that if you have more of the good bacteria, they will overcome the impact of the bad bacteria and that you'll be healthy. Now, but the data is divided. There are some articles that say that probiotics are good for you, and there are some that say that it doesn't make a difference. But we do know that having more good bacteria in the immune system, in the GI tract, is helpful. That's why fecal transplants have become successful, because they take uh, products from healthy people who have the so-called good bacteria. And this then knocks out the bad bacteria. But to answer your question is that the jury's not out. There's a lot of, there's as much evidence that says that probiotics are good for you, and some that say that it doesn't make a difference.
Okay, thank you.
But I think my opinion is that probiotics, for the most part, aren't harmful. That's what I would say. They're not harmful.
What's a good source of a probiotic?
Sorry?
What's a good source of a probiotic? What foods or?
Naturally.
Actually, they actually have a section in the drugstore that's actually probiotics. And you can go in and pick out the probiotic of your choice. But,
Dr. Callender, in the foods they say yogurt, cottage cheese, and kimchi are good sources.
Yeah, I don't know what kimchi is. The yogurt and cottage cheese, of course, they're dairy products. And, there's a lot of sources that say that dairy products can be harmful to people, to melanated people, that were lactose intolerant. Kombucha, that's a fermented tea. That's highly probiotic. You can get that at most groceries. It's called kombucha.
okay, let's go to the next one.
Yeah.
Oh yeah, this is yeah. I just get back in town from going to Florida, and what was interesting in the trip was that as I went through the airport and the plane, and it was probably about 1% of the people who actually wore masks. So that even though this is the flu season, most people no longer wear masks. this is a phenomenon during the pandemic and how it was. Too bad. Too bad you can't get the sound of a closed captioning. It's how it used to be. Nowadays, you see very few people with masks. And then, of course, there's the mask that you wear around your ears, which has its own problems on your effect on your ears.
Reading in 20, because my mask was 80% effective. That's a huge reduction, and that greatly reduces the chance that I'm going to become infected.
There was a lot of controversy over whether or not masks worked at all. Were you able to show that they work scientifically?
We were able to show that they block particles that are the same size that carry the virus. Because at that time, we were not working directly with the coronavirus. So we used kind of substitute particles that were the same size. The way a mask works is through filtration, which is not sieving. So we're not just pouring our pasta through and letting the big chunks not go through the holes, but it's really a different process. So what happens is that the virus is being carried through in the air, and it's not just going straight through those holes. It has to weave around all these layers of fibers in there. And as it's going around, the air is going around the curves, the virus may crash into one of those fibers. And so then it's trapped, or maybe it comes up close to the fiber and brushes against it. And the really small particles, like the virus by itself, if it were by itself, would be small enough that it undergoes these random motions because it's getting bounced around by the gas molecules, and it ends up crashing into the fibers of the mask too. And so there was accumulating evidence, and there had been kind of a handful of papers before that too, showing the same thing, that masks, even cloth masks, do something. We did a study of different types of cloth masks and showed that it's not just the filtration efficiency of the material, but also how flexible it is and how well it can fit to the face.
You once gave me an analogy of it's like somebody running through a forest and there's a million trees.
Yes, you could think of a mask as being like, if I shrink myself down to the size of a particle, trying to get through that mask is like me trying to run through a forest where, okay, if I were going slowly, I'd be able to navigate through those trees, but I'm being forced through this forest at high speed. I am running, and I cannot possibly maintain that speed without crashing into the trees.
Oh. So the bottom line is that masks do work. The question is how many people are willing to put up with the inconvenience of wearing a mask. And if you're over 65, then not wearing masks could be dangerous to your health, especially during the flu season.
Yeah, Dr. Callender, I just got back from Mexico by way of Houston and Chicago, and Houston and Chicago. And in those airports, of course, I wore my mask the whole time in the airport, and 95% of the time in the plane itself. But I still caught a cold. I did not get COVID, thank goodness. But looking around, maybe if I saw 100 people, maybe 4 or 5 people had masks. Really strange to see that.
Yeah. I didn't. In my travel, I was in Florida, and it was more like 1 out of 100. Yeah. So, and of course, this becomes even more important as we get closer to the end of November and December and January, because that's when the virus is everywhere.
Yeah, another germ hotspot when you travel are cabs and Ubers. It's a great idea to wear a mask when you're taking a cab or Uber.
That's an article that I thought was attractive because this article says that, and they have the data to show it, that getting the booster and the flu shot together increase stroke risk. The data is there, so this was particularly for those people who are over 65 years of age. And the other thing is that still everybody's not getting the high dose flu vaccine when they get their shots, because some people don't realize that there is a high potency flu vaccine. But the fact that there was a increased risk of stroke is not attractive, but people are still giving the flu shot and the COVID shot separately, but at the same time. But anyways, just let you know that the evidence is still there that there may be a risk to taking them together. So it may be better to take them separately.
So, Doc, I thought this was talking about combining the shots into one shot.
Well, it says, it says combining vaccines in high dose, and most of the people that I see get it done separately and not combined. They have two shots. They get two injections. And they're talking about combining. You're right.
Oh, they're talking about both of those in the same injection.
Yes. Yeah.
Okay.
Yeah. And there was a lot of publicity about trying to get both shots at the same time with one joke. And I think Pfizer had some trials on that.
Yeah, it seems like that would cause a stroke.
Well, why would it cause a stroke? I mean, why?
Because
Anyway.
it's too much for the body to take at once.
Well, who knows what's too much for the body to take? Yeah. But anyway, the data suggests that be wary of that. So get your shot separately.
You could get them at the same time, but not combined.
That's correct. Yeah. That's how most people are giving it anyway. Give it two injections, maybe in the same arm, but two separate injections. Yeah. That is an article that Darryl sent to us that is very important, because some people don't realize that noise pollution is serious and that it makes you deaf. And there's so many ways in which that can happen. And I think John Buchanan told us about how in his profession, noise is part of it. Of course, we call it music, but loud noise is, and of course it's interesting. I was listening to his podcast, and the one thing that I waited, they talked about all the different instruments that John played, but they never talked about the percussion instruments. And the first time I met him at Asbury, he was playing the percussion instrument. Although he masters very many instruments. It was interesting that in that podcast, I didn't hear them say anything about your mastery of the percussion instrument. Mark also was instrumentalist who I've met him, Asbury, playing percussion as well. Why is it you guys don't talk about the percussion instrument?
Well, that podcast was focused on one group in particular and how that group helped to develop go-go in particular, and performing in church services and things like that was something I've been doing for 40 years, but I've been doing the popular music for closer to 60 years. So,
I see.
yeah, so it was focused on the pop stuff, popular.
I see. Okay. But anyway, the noise pollution is something that sometimes we take for granted. You be going in a car and you hear all this loud noise, and you wonder how in the world the guy in that car could stand it. And it seems like it's reverberating all over, and you wonder how that guy ears are standing it. And the truth of the matter is that it's damaging his hearing, and he's just not aware of it. And that's something that noise pollution is something that can affect many aspects of it. Increase your blood pressure, your blood sugar, and more, and as importantly, it causes hearing loss.
Well, Counter, I've heard, maybe Darryl can back this up with some details from the internet, but some of these concerts that especially more young people go to, the speaker systems are so powerful that a certain frequency of the sound can actually stop your heart. If it's got the right frequency, it can actually counter your heartbeat and stop your heart and cause a heart attack. And I'm serious. Some of those speaker systems are so powerful that they could push you. I mean, you could feel the air pressure. And I played next to one of the loudest drummers for about 10 years, I think. And when he left the Soul Searchers, he went and started playing with Miles Davis. I mean, he was a great drummer, but I was right next to his cymbal, and that was on my left ear, and I have hearing loss in the high frequencies in my left ear. I would say as a result of that, because that was loud. But I never used earplugs until after I noticed the hearing loss. So it was too late at that point.
Mm-hmm. Any other comments about noise pollution?
Yeah, since I brought the article, okay, scroll back up, John, where it talks about 85 decibels, long repeated exposure to sounds over 85 decibels. That's not actually that loud. Most of our phones have apps where you can measure the decibel, that's the sound pressure level, and 85 is not actually that loud. A lot of times you're listening to TV and you can get up to 90. But okay, there's some other articles not included in this one that talks about the mechanism of loud sound pressure levels because it constricts the blood vessels, and so when it constricts it, it increases blood pressure levels. Like one of the things that John mentioned, transients, the spikes, and that's percussion instruments. That's their main thing. They produce sound transients, and that can change the heart rhythm, can give you atrial fibrillation, where you get the irregular heartbeat. But there's a lot of dangers associated. Being a musician is a dangerous profession because the sound levels are high. They can raise your blood pressure, and we musicians, we know that most of our musician friends, that have done it a lifetime now have high blood pressure. And it's probably a result of being a musician. Um, During the pandemic, those were some great years for me because my diet was able to control my high blood pressure without hypertension medicines. And then the pandemic was over and I got back to gigging regularly again with high sound pressure levels and couldn't control my blood pressure just with diet anymore. I had to go back on hypertensive meds. Uh, but now I'm more aware of, a quiet lifestyle is healthy as far as sound levels. I use my app and I measure. I know what my levels are for listening to music at home, listening to music in my car. Like on my car, I was listening to the music was getting up to 31, 32 on the dial. That was my sweet spot. But now that I measure decibels, I know that it can't be more than 24. But, big difference. But, I've got to do those things that control my blood pressure, control my health, because loud sound is a killer.
There was a point that Dr. Callender raised, John raised, and most musicians know. Why they don't give honor to percussionists? Because the majority of them are not trained. They can't play jazz. Most of the time now, even in churches, they play like they're beating their brains out. You might have the technical skills, but they don't know how to do it soft. Industry has the electronic drums, and most drummers hate them with a passion because if they can't get that reverb, if they can't hear it and feel it, now churches are putting them in boxes and everything because they're recognizing it, because choirs are saying they can't hear themselves over the music. They understand this, but the instrumentalist said, we got to hear ourselves. So they got these monitors and then they are putting thumbs up to turn everything up and etc. We're actually killing ourselves as far as the sounds. Not only our heartbeat, it does scientifically, and they have it in textbooks. There are certain type of like heavy metal and etc. The music actually does kill you because it increases your heart rate, your blood pressure, and it's just like your body exploding because of the sound. They had a test about remote villages in Africa, etc. Those people live, their blood pressure and everything, because you can even hear an ant crawl almost, because their ears, their body, they have silence, just the noise there's noise even in nature, but the silence is what heals your body. So when you're asleep at night, they tell you don't go to sleep with all this sound pounding your ears. It raises your blood pressure. So just peace and quiet helps your body overall and your ears. But our percussionists, they don't get to play because there's very few like John Buchanan and my son who can read percussion music. Most musicians, a lot of musicians didn't even know you could read percussion music. They have no clue. They know you could read piano music and etc., but very few of them know that percussionists read music, because most of them are not trained. They are good in their gift, their craft. They can really get the rhythms and everything, but they can't read it and they don't know how to play soft. Okay, that's all I have to say.
I now ask the congregation to turn to the hymnal 132, Blessed Quietness.
Yeah, well, I've heard both Mark and John, expert percussionists, so I've been blessed. Okay.
Dr. Callender, is that, the more hearing loss that you get, the louder the music has to be for you to hear it. So like a never-ending cycle,
Yes, that is well put. Well put. We deaf people know that.
Gotta be louder. I can't hear y'all.
This is kind of scary that exemptions for required vaccines reach a record high, which means that more of our kids are not being vaccinated. We know that there's a lot of medical exemptions. But when the level of exemptions gets too high, it makes you wonder whether or not they are people who really should be exempted from getting vaccines. And you see all these diseases that you're prevented from getting because of vaccines. And of course, as you get older, the number of vaccines increase. And so what this suggests is that our long-term survival rates are going to start going down. Question is, do your children and grandchildren, great-grandchildren get their vaccines when they go to school, or they get exemptions? Of course, we talked a couple of sessions ago about the HPV vaccine, and how they started at the age of 9, I think, is although some people think that's not low enough, but at least at the age of 9, they start getting the HPV vaccines. The others they get from the time they start school. And the fact that these exemptions keep rising is a little concerning about how our kids are being protected. Has that been a number of you are teachers, has that been your experience, that the number of kids who are exempted from getting vaccines is increasing? Any comments?
No, because the nurse office, they don't tell you who's back. They just come to their room, they deliver a letter, go home because you're not vaccinated. But other than that, we don't have a clue. And then about grandparents and etc. You know, there's too many things we could tell our adult children how to raise the children, and there's only so much they're gonna listen. I don't know how many people have experience, but I can't even keep track on how many times they go to the bathroom, what they're eating, and Lord knows where they're going to the doctor and what vaccinations they're going to get. That's too much stuff to keep track of. So I don't know how we're going to warn our children to tell their children what doctors they're going to and what vaccination and what foods they're eating. You just stand back and smile and say, bless their hearts.
And you keep them in prayer, huh?
Yeah, you keep them in prayer. You keep them lifted up all the time. And hopefully you can tell them, like I try to tell my children about football, how dangerous it was. And they looked at me and say, okay. And then went ahead and took them to the sports event. If somebody has a clue on how you can tell your adult children how to raise their children, give me a clue, give me a book or something on it, because I haven't that stage yet.
I think Solace will reign supreme. Well, okay, well, you know, we keep worrying and wondering about how many are going to actually take the vaccines and how our children and children's children are going to do. So I guess we do the best we can and pray that God will be merciful. Yeah, this was an article that I thought was interesting because I was introduced to this because Victor Scott, who is our gastroenterologist, his mother died at 99 of colon cancer and metastasis. And they had asked his mother at the age of 89 whether or not she should have a colonoscopy. And he said, well, at 89, she said, how you know how long she's going to live anyway? And so he did not press on that. And lo and behold, 10 years later, she died at 99 of colon cancer. But the bottom line is that they recommend that if you are over 70 and you are expected to live for 10 more years, that you should get these screens, breast cancer, colorectal cancer screenings. And if you're not expected to live for longer than 10 years, then you probably don't need to get it. But so it's recommended that even if you're 50, 60, 70, and even 80 years of age and you're in good health, that screening is desirable. The key then, of course, is good health. What is good health at 80? The presence or absence of comorbidities is what makes for good health. Able to get around and not have a lot of the so-called comorbidities, which most of us have anyway, which is hypertension, diabetes, and COPD, and the other illnesses. And then, of course, we know that the PSA and MRIs for prostate cancer become important after all of these after the age of 50. So now this is a question that I was surprised. The upper limit for lung cancer screening was 80 years of age. And the expectation is that if you had screening at 480, then you're not likely to get it after that. But suppose you didn't have screening, because how many of us get screening for lung cancer? If you're not a smoker, most people, if they're not smokers, they don't get screening for lung cancer. So of course, if you're not a smoker, then the likelihood of you getting lung cancer is not as great, but it's still there. What about multi-cancer and DNA tests? It's one of the interesting things about DNA tests is who gets them and when, and how do you keep your genetic information private. And there's an expectation that as we grow older, the value of genetic information becomes greater, but also the risk of your genetic information remaining private becomes less likely as well. Question is at 65, 70, 75, how much screening are you going to do doing? And as the risk of cancer increases as you age, the need for screening increases, especially if you remain in good health.
Dr. Callender, this addresses John Tatum's question about artificial intelligence. This question.
Well, I don't, what is interesting to me is AI. It seems to be more helpful as you look at the different disciplines. Radiology and pathology, AI is tending to be more reliable than human beings. And this does go back to the question about the robot and other things. We're doing more robotic surgery to eliminate the vagaries of old age on the surgeons, because the tremor is not there with the robot. And AI is kind of taking over a lot. And it is clear that AI may be better at looking at x-rays and looking at pathology slides than the human eye. So that it's going to be interesting over the next decade to see whether or not AI is going to replace some of the ways in which we do radiology and pathology slides. And I think robotics and AI are with us for the long run. In the short run, it may not be as desirable as we think, but I think in the long run, AI may well be the difference maker. And this paragraph says it all. My philosophy, their guidelines, if they have a limited life expectancy, they shouldn't be screened. If they're going to live longer than 10 years, then they should be screened. So, but how do you know if you're going to live longer than 10 years? People die of MIs 40, 50, 60. So how do you know? So it's an interesting philosophy. Question is, over time, what are you going to do about it?
I'm going to get screened.
Okay.
I had a doctor tell me, oh, now that you're 70, you don't have to, you shouldn't worry about getting mammographies. And I told him somebody that has no breasts is not going to tell me what to do with my breasts.
Men have
Well,
breasts, and men get breast cancer.
actually,
Yeah,
men
but you
have
don't
bre-
put them in
men
no,
have breasts.
in no
Men have
mammogram
breasts.
machine.
Men have breasts and men have breast cancer.
I know, but they don't put them in no mammogram machine.
Yeah. So true. So true. Yeah. Okay. Any other comments on the screening philosophy?
Oh, Dr. Callender, my mother got breast cancer at 93.
That tells you.
It was on the surface, and they did the surgery, and she was fine. But they were asking her, did she want to have the surgery? And she said, yes, I do. And they were, trying to talk about what we could palliative care and stuff. And she said, no, I want to be clear of cancer. And they were like thinking that she wouldn't want to have treatment
Surgery.
because she was not, because she was, well, at the time she was 90. But she died at 93. So, but she didn't die from breast cancer.
Thank you for sharing. Any other comments? Okay, do we have any more other slides?
This last one.
Okay, all right. Oh yeah. For those who think that TB is gone, TB is ever present. And this is a example of TB exposure at an Omaha daycare center.
Oh my.
Yeah, which most people forget about TB, but it's a very contagious disease for which treatment exists from most, although there are some tubercular bacteria that require special medications. Sometimes they have symptoms and sometimes they don't. And sometimes it affects the lungs and sometimes it affects other parts, such as the kidneys, the spine, and the brain. But the one thing is clear is that it is an infection and it spreads. And to have an infection like that affects 500 people is a cause for alarm. Most people know that it affects the lungs, but many people are not aware that it affects other organs.
But Calendar, it seems like this is another very dangerous disease because some of the people that have it have no symptoms, so they're asymptomatic, and they could be contagious. And I mean, if 500 people have it in Nebraska, I mean, where are those people restricted to Nebraska? No, they're traveling all over the country, and some of them don't even know that they're infected. So it just reminds me, like Ebola. Ebola was a very containable disease because once you got it in like 2 or 3 hours, you were dead. So you could trace it, you could trace it. Okay, that person's got it, he's dead. The next person got it, he's dead. So you can find out where it is. You couldn't have it and transmit it without knowing you had it. But something like TB, like COVID, you can have it and be asymptomatic and spread it around. So I'm just about as afraid of this as with COVID. What do you think?
Great. You're wise.
Mhm.
Yeah, you're wise. And TB is still with us. It's not as common as it used to be, but it's dangerous and it's lethal. And your concern is legitimate. And you still have people who come up with a latent infection that they never knew they had, that they had all the while, but were never aware of it. And because everybody doesn't get chest X-rays,
Right.
so your concern is legitimate. Yeah.
Is that the only way to detect it?
You mean by X-ray?
Yes.
No. You actually can detect it by sputum. Sputum tests. You get sputum, and they find the bacteria in the sputum, or in the more commonly in the sputum, or gastric washing sputum. Common. But some people who have it latent and never knew they had it, they get X-ray, and X-ray shows it, and then you do the skin test and other things, and you find out they actually had latent TB that they were never aware of, and so they put them on medication to knock it out completely. So it's
I had a friend, Dr. Callender, that she went for a job and had to get the skin test, and she had to come back for them to look at it, and she had a reaction, and they put her on medication, and I think for 20 days or something like that, and she eventually got the job, but that was how she found out she had it.
yeah. And it's actually required in the hospital that you get an X-ray or TB skin test
Mhm.
every 2 to 3 years.
Do you mind speaking a little bit about pneumonia? I'm finding that young people age 30-ish are getting pneumonia. Some have no symptoms. And yeah, and can an infection from TB and lead to pneumonia? Whatever your
Yeah,
thoughts are.
pneumonia is a disease that affects people at all ages. And what happens is that you get an infection that, and there are all kinds of pneumonias. There's the bacterial pneumonia, there's a fungal pneumonia, there's a protozoan pneumonia, there's a viral pneumonia. So what happens is that the infection goes into the lungs become inflamed, and therefore you can't breathe. And if you can't breathe, of course, then the end result is that you die. We talked about earlier about the ECMO treatment that is present, in which even when your lungs are don't allow you to breathe, they can put you on a machine, and the machine can breathe for you. So that getting the diagnosis in time so that pneumonia is not fatal becomes important. And so when you have chest pain or shortness of breath or coughing up greenish material, rust-colored material, or blood, these are signs and symptoms of pneumonia, and they require treatment, because if it's not treated appropriately, then it's lethal. And as you mentioned, it occurs in the young as well as the middle-aged and as well as the old. And so one of the earliest symptoms is coughing up material that's yellow, green, and rust-colored blood. Often when we think of blood, we think of TB. Coughing up blood, we think of tuberculosis. But pneumonia is probably much more common. And the problem with pneumonia is if it's not treated, it can take you out of here within 3 to 5 days. So if you have a fever, chills, or anything like that, and you have coughing up material that's yellowish or greenish or brownish, then that requires going to the doctor and getting treated so that you can recover. When treated, it usually can respond to treatment within days to weeks. So early diagnosis when you have fever, chills, or coughing up sputum that is colored is an indication that you should see your doctor, and as soon as possible. And if you can't get an appointment, go to the emergency room, especially if you have a fever or chills or anything like that.
Yeah, some of the causes of pneumonia can be alcohol, smoking, vaping, and lowered resistance through poor nutrition. A lot of the young kids, they're eating empty calories. They're eating a lot of fast foods. They don't cook, but they actually have poor nutrition.
Mm-hmm.
I have a question, Doc. Is there such a thing as contact tracing for tuberculosis?
Say again?
Contact tracing. Do they have that?
Oh, yeah. Oh, as a matter of fact, TB is more contagious than COVID. And in the old days, unlike what they do now, you were in isolation for TB. Not just the social isolation. They put you in a special unit to keep you from infecting others, because it is very contagious disease. It's not as contagious as chickenpox, but it's very contagious, and exposure to people with TB is associated with people getting TB, just like some pneumonias can be transmitted similarly. So if people are coughing and they're not wearing masks, you're not wearing masks, they can cause that infection to be transmitted to other people. Any other comments or questions relative to pneumonia or TB?